Good afternoon, everyone. Another episode of Drive Time Biomechanics. Once again, I'm Louis DeCaro, and I'll be your host again. And this is a special episode, and it actually has to do with picking up orthotics. So patients come in and they get custom functional orthotics from us, and the pickup is an extremely important visit that the patient really needs to be educated about, as the practitioner needs to know how to do a really informative pickup. So let me take you through one of the pickups. I have some examples of some orthotics with me. I have some handouts that I give patients. Let me take you through a pickup and let me take you through what I think is important to consider when it comes to orthotic dispensing. So the first thing I want to know when I'm dispensing an orthotic with a patient is what is their number one goal. Patients sometimes have many different goals. They have many different pains. But what I first want to know is what is the primary goal? And I want to focus on that. I think that's very important to set our goals in order and proceed from there. If something is really killing the patient, let's attack that first and let's get that better. The second thing is the term acute symptoms. This is extremely important. Patients get orthotics because they want pain to go away, but orthotics are not great at getting rid of existing pain. Now, sometimes they're very good at it, but overall, I don't dispense orthotics to get rid of pain per se, or that being the primary goal. I dispense orthotics mainly in order to prevent further pain or prevent pain from coming back. So we have to understand what are the acute issues that are going on that may be chronic at this point, and we need to be maybe concurrently treating them with some sort of injections or strappings or whatever, and not necessarily having the patient believe that the orthotic is going to be the thing that gets them out of pain. Like I said, sometimes that's the case, but not all the time. Work and play shoes. So a patient comes in, and first of all, patients should never buy shoes prior to picking up the orthotics. A patient should just use their regular shoes up until they get their orthotics, and then the design of the visit of the orthotic pickup needs to be such that a patient needs to be educated about shoes that are good, that aren't good. So I always have the patient not buy shoes before the pickup visit, as well as bring in basically their closet of shoes they wear. And what I do is I critique them one by one. I go over the shoes. I say this one's good, this one isn't good, and so on and so forth. And from that, the patient can learn what's good, what isn't. They can kind of see examples, and I can actually start to really educate the patient on their shoe gear. I have handouts that I use. We went over this in another video. I have a handout here that based on what foot type they are, they actually get a sneaker handout here that gives them a really good range and idea what sneakers to buy. And then I actually have a comfort shoe handout, for which is on the front is a female comfort shoes, and on the back is a comfort shoe that they would wear to work. Because a patient is going to play and they're going to work. And I think it's very important to wear the orthotics in both shoes. But patients need options because orthotics don't fit in all shoes. And so we always hand them options of things to get. No one leaves the office empty-handed not knowing what to do. So shoes are very important. I make the patient stand on the orthotic barefoot. I line the orthotics up the way that their foot naturally stands. So if someone stands with their feet out, it's very important to have them standing with their feet out on the orthotic or lining up the orthotic. Because if you don't, sometimes if you line up the orthotic straight and the person doesn't stand naturally that way, they can have an adverse reaction to standing on the orthotics, and it can be simply because you didn't line up the orthotics correctly. Shoes. We talked about shoes, picking out shoes, bringing the orthotics to the facility that they're going to buy shoes, fitting them in the shoes, making sure things fit. Sometimes, especially when we have forefoot posting in the orthotics, it takes up a little bit more room, or the width of the orthotics take up a little bit more room. And so sometimes the shoes can go up a half size, or we have to go wider with shoes. But what we also need to talk about is the wearing pattern of the shoes. I can have a patient who can have a nice pair of shoes, but on the lateral aspect or the back aspect of the heel may be carved out. An orthotic in its heel correction usually is only about a few degrees of posting. And so if you have a shoe that a patient's going to wear it in, it may be a really nice shoe, but if it's carved out in the back a few degrees similarly, the patient is not going to get the positive effects of the orthotic. So if a patient comes in and they have a really nice shoe that I think is going to accommodate an orthotic, but there's wearing of the shoe, I'll actually refer out to a shoe fix facility, a cobbler, in order to try to resole the shoe to save the patient some money. Bending of the shoes. Patient may have a good pair of shoes, but they may be a year or two old, and we take them and we bend them. And we talked about this in the other video, but when a shoe bends too much, a highly functional orthotic or a hard orthotic is going to be something that is not going to be comfortable into a shoe that's going to bend a lot. Forefoot posting. Let's talk a little bit about the makeup of an orthotic. So I have 3 examples here. I have an orthotic that is for a little kid. I think this is actually for a 4-year-old. It's a pretty simple orthotic. It's a UCBL extra depth orthotic, and it's going to fit pretty much into everything. And then over here I have a second example of a custom pair of orthotics for an adult here. And this orthotic, nice deep heel cup. I believe a deep heel cup is important in most orthotics to control the heel. But what you see here is really not much of a forefoot posting or something that kind of sticks out off the orthotic. This orthotic is going to fit in a lot more shoes. But then when we get to an orthotic, which is actually very, very common, it actually has what we call a forefoot posting. And that's something that's kind of sticking out underneath the metatarsal heads of the foot. This is going to take up room in shoes. And so this is going to be something that a patient really needs to pay attention to. And it's going to be imperative that they take these with them to the shoe store and fit them in. Take the insert out that comes with the shoe, fit them in, and then make sure that their foot is comfortable. Many times patients will have existing shoes, and if they get a forefoot posting on their orthotic, they'll put them in and the shoe will be too tight. And so many times they need to go a half size up or sometimes increase the width. Forefoot posting is more common than not with my orthotics, and I believe that actually neglecting adding this piece in oftentimes is why a patient actually fails with orthotics or doesn't get better. Long-term goals. Orthotics don't just provide relief, they don't just get rid of symptoms, but I think the most important thing that they do is they provide long-term goals. I specialize in pediatrics, and one of the reasons I do is for prevention. We want to prevent issues going forward. We know that certain foot types that have, let's say, Sever's disease as a child, shin splints as a teenager, will progress into knee and hip pain later on. And so the long-term goals of our patients need to be explained very clearly to them. Why am I wearing this orthotic? Well, you're wearing this orthotic for a whole host of reasons. To get rid of your pain, hopefully, to prevent pain from happening immediately, and then long-term, there's a whole lifelong things that can happen to a patient. There are no good feet. So patients come in and I tell patients, and this is true, that I pick on everyone. There are no good feet out there. Feet were designed to pronate, and everybody pronates, which means that the foot moves a lot. And why do we pronate? We pronate because our feet were designed to run after our prey in the woods and kill it so that we could eat dinner, or run away from that something that is preying on us in the woods. And they were designed thousands upon thousands upon thousands of years ago, millions of years ago, in order to do these things, and we were barefoot. But nowadays we're living with feet that are stuck in shoes, on hard surfaces all the time, and so our foot has not adapted to it. It still pronates, it still moves, and all feet do that. And so henceforth, all feet are probably going to be troublemaker feet. And so I actually educate everyone of why their feet are not good. I'm a big believer, if any of you know me, that orthotics are pretty much good for everybody and essential in some way to everybody. So patients come in and I pick on them all, but I say to them there are no good feet. And so it's important you understand why your feet aren't good. And moreover, what your feet are going to do to you. Bad feet, which are pretty much all feet, don't always just cause foot problems, but many times they lead to ankle, hip, knee, back problems as well. And this is actually something that's very underdiagnosed. Having bad feet, which lead to hip pain. This is something that needs to be seen more. Limb length discrepancies. People sometimes have limb length discrepancies. Now, when I started 16 years ago, I often would treat people with lifts, and we talked about this in another video. Nowadays, I actually prescribe the orthotic, and then I tell the patient to come back and I listen to them. Often, not often, but sometimes patients come back and say, these are the greatest orthotics in the world, they make me feel good, but now my left knee is hurting or my right hip is hurting. Well, the feet are major compensators for limb length discrepancy, and if we make the feet really, really functionally correct, we're actually going to draw out some of the weaknesses. So if a patient comes back and they have another ailment in another joint, then we're actually going to send them to physical therapy to try to figure out what their issues are with regards to limb length and what functionally we can correct. The third thing that we hand out with all visits here, and I think handouts are very, very important to patients. And by the way, all these handouts that I'm mentioning in this video are available at decaropodiatry.com in PDF form, is the orthotic break-in instructions. Orthotics should not be broken in fast. They should be increased 1 hour per day in the shoe of walking around. Orthotics occasionally squeak. We like to use dryer sheets underneath the orthotics. That's a really great tip for orthotics that squeak. If you play a sports or a big runner, not using them until at least a week in or 10 days in is advisable. We want to get you broken into the orthotic, wearing them regular wear until you're going into a cleat or a sneaker, or you're playing an athletic event, or you're doing something with the orthotic. So wait a week to 10 days. We talked about choosing the correct shoe. And then orthotic checkup. I like to check up on patients who are adults every 12 to 18 months, unless they have a problem, of course. And then with kids, I like to check on them every 6 months. So hopefully this was helpful. Talks a little bit about what are the concerns about dispensing orthotics for the practitioner as well as the patient. Some of the things I think about, some of the things we need to be aware about with regards to shoe gear, wearing of shoes, the type of shoes to wear it in. I'll catch you soon for the next Drive Time Biomechanics. Thank you very much for joining me. Have a good day.